I've been interested in diet for a long time because patients always ask about it, and there has been some suggestive data for many years on diet and its potential role in the MS process, even just in risk of MS. Going back to the 1950s, people were looking at diet as a potential role in risk of MS and finding that high levels of saturated fat were associated with, it doesn't prove a cause and effect, but associated with the risk of MS in people who are otherwise similar genetically. Well, we've had a couple of studies that have looked at reducing saturated fats that have been tentatively positive, but they were not, there were some flaws in the studies. There have been studies using polyunsaturated fats that were also tentatively positive, but need to be corroborated. There are studies looking at dietary components like vitamin D, which seem to indicate that higher levels of vitamin D may be beneficial, both in terms of reducing the risk of MS and also in terms of treating the disease once it's established. There are studies in animal model, which is what I discussed more during my talk, looking at calorie restriction. That's work that came out of our laboratories and also some others too, that suggested that can be beneficial in reducing the severity and even the incidence of the disease model. There are data on even intermittent fasting, which I presented from our laboratory, and I want to mention the name of Laura Piccio, who is my colleague who really has been instrumental in those studies and sort of a driving force in those studies. And there certainly are animal data on adding vitamin D to make the model better as well. Well, there's something to calorie restriction, though, that's different than just changing the diet, actually. There are cytokines called adipokines that are made by white adipose tissue, fat cells, and the cells that are in the white adipose tissue besides the fat cells, like macrophages, and there are a few other inflammatory cells there. And those cytokines or adipokines that are made by fat tissue change depending on what your diet is and whether you're eating lots of calories or fewer calories. And it turns out that when you're eating fewer calories, when you're calorie restricted, you make more anti-inflammatory types of adipokines like adiponectin, which is one that we're particularly interested in because you can give adiponectin to the mice that have the animal model for MS and make them much better and cause T regulatory cells, at least phenotypic T regulatory cells, increase in those mice. So adiponectin goes up naturally if you're calorie restricted, and it goes up if you're intermittently calorie restricted, like say you're calorie restricted one day and then the next day you eat normally, not overeat, but just eat normally. So, so that's a way to increase a good cytokine, or certainly potentially good in MS, although it hasn't been proven in MS. And then there's another adipokine called leptin, which we think is bad in MS. It's pro-inflammatory. Mice that don't have leptin due to genetic changes, those mice won't even, you can't even induce them to get the experimental autoimmune encephalomyelitis model. They're very resistant. So lowering leptin is good, and leptin goes down when you're calorie restricted and goes up when you've got more fat tissue. So all in all, I mean, there's a good scientific rationale for why this could matter. There are two clinical trials that I'm aware of that are both, these are difficult to run, I'll say that are both ongoing. One is, to my understanding, it's not being done by us, a calorie restriction all the time study, and then we're doing one of intermittent calorie restriction where we're randomizing patients who are having a relapse into intermittent fasting versus not intermittent fasting. And again, I want to give credit to Dr. Laura Piccio, who's the driving force behind that study. So we don't have data, and we only take in patients who have elevated body mass index, BMI. So we're not taking really thin people in and making them thinner. But we figure if they lose weight and it doesn't help their MS, I mean, at least they'll lose weight and maybe that'll be good for their cardiovascular health. So I do think that patients with MS ought to have an adequate vitamin D intake because of all the data there is to support that now. And in general, we're recommending around 3,000 international units of vitamin D3 per day at our place. Others may have different, but we always check the vitamin D blood level first, and if it's really low, we may supplement with even higher levels and recheck. And in terms of diet itself, I sometimes will tell my patients about the data in animals and tell them also that this doesn't necessarily apply to multiple sclerosis, but if they're overweight, I will sort of use that as a carrot to lose weight anyway, because I think, you know, you want patients to be healthy all over, not just neurologically. So, but you have to restrict calories in a nutritionally sound manner. So at least in our study, we have a nutritionist involved who talks with all the patients and keeps in touch with them during the study.